the incidence of oral cancer, the number of people that are diagnosed continues to go up year after year. So since 2011, the number of people that have been diagnosed with oral cancer has doubled. As terrible as periodontal disease is, and as much as, we want to cure that, we want to fix that, we want patients to be better, it's not life or death. And oral cancer is, and we have the ability to truly change a patient's life just by offering a screening. If your next patient in your chair was your loved one, do you feel confident in the screening that you're providing and in the technology that you're using to tell them you're healthy, you get a clean checkup, and to send them on their way? And I think, that's what we all need to be asking ourselves every day on every patient. Did we do a good service? Did we really do our job?
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.
Welcome back, everyone, to another episode of A Tale of Two Hygienists podcast, an Endeavor Business Media production. This is episode number 384. My name is Andrew, and thank you so much for listening to the show today. Really excited about this one because we have on Ellen Myers for today, and we talk a little bit about oral cancer and the screening process. It's always a really big deal to talk about this, but it seems like we always focus on it more in April. So hopefully this episode will be the reminder to kind of get it going for, the end of this month and into June as well. And then next week we have on Dr. Ben Holbert, and we talk about what it's like working as a newer doctor or working for a newer doctor and how those dynamics kind of play in an office. It's always interesting for me, at least, to hear how offices, either they embrace the new doctors or they kind of react poorly and they don't maybe embrace them and teach the young doctors the way that they should. And in my experience, there have been lots of new doctors coming through the doors of our offices. So I thought that this would be a good episode for you that might be experiencing that right now, or maybe in the future, picking up some tips and tricks to kind of help you cope with that situation. And then kind of as a follow-up, I just posted an RDH rant to see if anyone wants to be a guest on an episode where we talk about our experiences from the hygiene side of it, working with a new grad or a recent grad. And the idea is kind of more like a point counterpoint. They told their side of the story. Now we get to tell our side of the story. So if you want to be a part of that and you didn't happen to see that in the group, or you're not a part of that group, you can always send me an email, Andrew@A-Tale-of-Two-Hygienists, if you want to be on that roundtable. I would say the only caveat for that is that I am looking for someone that does, actually several people who have firsthand experience with new grads or recent grads. RDH Under One Roof 2023, as you all know, is sold out. But if you're interested in reserving your spot for 2024, it'll be in Denver. They did just open up registration. And from what I've seen, the resort itself is maybe a little bit smaller, but I think from what I heard, the meeting space is about the same size. So that's both good and bad in the fact that it's probably going to sell out again. And so if you want to make sure that you have your space, make sure you head over to rdhoneroof.com and go ahead and register for next year's event. I think that's it for me. Congrats to all the new hygienists graduating this week and over the next couple of weeks. We're very proud of you. We can't wait to welcome you into our offices, and enjoy this episode with Ellen Myers.
A tale of two hygienists.
All right. Welcome everybody into the interview portion of the podcast. I'm so excited today. We have Ellen Myers with us today. Ellen, thank you so much for making us part of your day.
Thank you. It's a pleasure to be here.
How nervous are you for a podcast?
This is my first podcast ever. So I am like, what do I expect? But I'm excited. I'm really excited.
No, I'm excited too. We were connected together by mutual friends. And I think that this is something that, like, anytime that ever happens, I feel like there's magic. I feel like it's like, oh, like you guys are going to be buddies and like, this is going to be a good message. And so don't worry about like any of that. Like everyone that's ever been on the podcast is always like, oh my gosh, I want to do it again. And so look, you have another topic you want to talk about later on, you let me know, I'll get you back on. But I think I want to start off, the audience generally likes to know, who is this person that's talking to me? Like, and why are they kind of like an authority on this particular topic? So if you don't mind kind of going through like your maybe career in dentistry and kind of what led you to this point in life.
Yeah. So I am a registered dental hygienist. I am a native Texan, born and raised, have never left. I went to Texas A&M University in College Station, and my mom has been in healthcare. She's a registered dietitian. My dad's a family practice physician. So they really guided me towards, like, okay, you're going to school. What are you going to study? So I went knowing I'm following prerequisites. I want to go to hygiene school. This is what I want to do. So I went there for 3 years. Then when I got into, it's now the Texas A&M College of Dentistry, which still sounds really weird because it was Baylor when I was there.
Yeah.
Still a hard thing to transition to, but went there. And then I practiced clinically for a prosthodontist in Dallas for a little over 7 years. And when my husband and I met, he was living in Houston. And so it was like, okay, whose work is transferable? And obviously I could get a job anywhere. So I left, came to Houston, practiced for a larger practice of general dentists for like 3.5 years. And then along the way was introduced to Forward Science. And they were still pretty young when I was first introduced to them. Actually, they didn't have a sales team yet and not quite as big as we are now. But long story short, things ended up coming together and I took an education role with them. And that's been 4.5 years ago now. I'm the director of training and education there. I still keep up my license for hygiene, and it's been a great journey, just really seeing our industry in a different way than clinically and making an impact in a different way. But yeah, it's been fun. That's kind of my story.
No, that's amazing. Do you mind if I ask you I know we're going to be talking about like oral cancer just in general, everybody. We're going to get to it, don't worry. But I kind of like just like the practicing in a prosthodontist's office. I think my brother might have done, my brother's a hygienist too, but I think he might have done it one time, but we never really talked about what is kind of like the difference of working there versus like a general practice. Did you notice any big major differences?
I did. We were much quicker to refer out when it went outside of our realm of specialty, right? Mm-hmm. So, we did a little bit of scaling and root planing, but not a ton. I feel like when you're working for a specialist, they're much more in tune to, hey, this is my realm of expertise. And then if it gets outside of that, I'm going to, punt to someone else, which I really respect, that they have the ability to see that and do that. But obviously it was a very, very high end practice. So in that we didn't see as much, by the time people came to us, they were doing full mouth rehabs. We saw a lot of the bad work that needed fixing, honestly, is a lot of what came to us. But then things that I didn't even get exposed to in hygiene school because, you just didn't necessarily have that patient come through during, your clinical time. So, I remember doing like cleaning my first hybrid and being like, how do I work around this? All kinds of contraptions to get places, but very, very neat. I feel like I was awarded the opportunity to learn from some really fantastic, experts in the field and see really good work. And it really gave me an appreciation for, the art and the skill that they truly have at that level.
I remember seeing my first All-on-4, by the way, too. I was probably just a couple years out of school. I'm like, wait, no one taught me about this thing in school. I'm sure they did. Like, no, I'm not trying to fault my educational institution, but I'm like, okay, so do I just like try and like brush this little thing? I mean,
can I use these instruments? Like what?
I don't scrape this metal, do I? Like, what do I do to this thing? Anyways, it was the most bizarre thing. I felt so stupid afterwards. And then I felt stupid continuously years after that. But anyways, so I want to get it. So you're kind of coming from, a healthcare centered family.
Mm-hmm.
Was oral cancer, like, were you guys talking about that early on in your career, or is this something like a passion that kind of later came on as you came with Forward Science?
Yeah, no, it wasn't even on my radar. And it's something that, I talk about all the time when I educate, that some of the new, statistics and risk factors were things that weren't being discussed at all when I was in school. I don't have a family member that's suffered from this. It's honestly been something that once I got over to Forward Science and have truly seen the myths, for a lack of a better term, in our industry, that you can't help but become more passionate about it, of seeing like, God, there's so much opportunity for us to do better here.
Mm-hmm. Mm-hmm. No, I can identify with that for sure. Like sometimes you just don't know what you don't know, right? And then as soon as it kind of gets put in your lap, you're like, oh my goodness, like this is something that I should have been kind of paying attention to this whole time.
Right.
All right, so are you ready to get into it? Are you ready to get into
I am,
okay?
yeah.
So I guess maybe like a good starting place is just talking about the trends. Kind of what are we seeing right now in the trends of oral cancer?
Yeah, absolutely. Great question. So, unfortunately, there is one cancer out of all major cancers that has not changed its mortality rate in the last 3 decades, and that's oral cancer. So, the 5-year survival rate for oral cancer has stayed the same, and it's right around 60%. So, for really my entire life, this survival rate of oral cancer hasn't changed. And that's, what blows my mind when you think about all the advancements. I mean, even just in, the time that you and I have been in dentistry, we've seen so many advancements in technology and, oh, well, we used to do this way. And now look what we can do now already, that it's like, why is this way? And that the incidence of oral cancer, the number of people that are diagnosed continues to go up year after year. So since 2011, the number of people that have been diagnosed with oral cancer has doubled. So they're projecting. So every February, the American Cancer Society comes out with projections for every cancer. And they're projecting that for 2023, 54,540 people will be diagnosed with oral cancer this year. So unfortunately, if we put that all together with what I said about the survival rate and then this incidence, that means that every year more people are dying from oral cancer because we're having, more people are being diagnosed. The same number of people are dying. So unfortunately, right now, one American dies every hour from oral cancer.
That doesn't quite seem like what should be happening in medicine. I feel like we're going the wrong way. Like what's happening there? Like, why aren't we getting ahead of it? And I mean, is there just lack of research or what's happening?
Yeah. So, I do think that there's a couple of different things that go into it. One thing, that is really important, and this goes back to what I was just saying about not feeling like this was something that was talked about. So this month marks 15 years since I graduated from hygiene school. And I know that this wasn't something that was talked about. And that's, as clinicians, we need to be looking at who we're screening. So that traditional risk factor group that we're so used to hearing about. So patients who have a previous history of cancer, they're over 40 years old, tobacco users, excessive drinkers are no longer the majority. So the problem is that there's this other huge demographic that we're not talking about. And that's that 60% of oral cancers occur in patients without any of those traditional risk factors. And that is from sexually transmitted HPV, the human papillomavirus. So that's the fastest growing oral cancer population that we see. It's happening to patients that are under the age of 45 who don't smoke, don't drink, don't chew tobacco. And it's responsible for a 5-fold increase in oral cancer diagnosis. So, truly, this is the problem and what needs to be being talked about in regards to, what's causing more people to be getting it. But I do think, there are some other things that affect, some of the trends that we were talking about. But, really to kind of encompass that, it's something that to really wrap our heads around how big this problem is. We're doing such a good job in educating patients to stop smoking, that excessive drinking is bad, right? But this HPV positive cancers, they're up 225%. So, when we talk about that, a 225% increase in oral cancer diagnosis that's specifically related to this one risk factor is why are we not talking about this more?
This is completely probably outside of what you're studying, but is HPV is it new? Is that the thing? It just didn't exist 50 years ago, didn't exist 100 years ago. And now all of a sudden it's wreaking havoc on everyone's mouths or the oropharyngeal.
Yeah. So, that's a great question. I don't know when HPV started. I do know that it's incredibly prevalent. There's over 200 different strains of HPV, and the majority of them don't cause cancer. The majority of them are immune systems clear. And this is something, females for sure, I feel like are a little more educated on because we know, the pap smear, right? That we get pap smears, and a lot of they're checking for HPV. So, the problem is that there's like 3 to 4 strains that actually cause cancer. HPV 16 in particular is responsible for 90% of pharyngeal cancers, or cancers in the back of the throat. So, the problem is that we're really not taking a hold of this from, an educational standpoint. But then number 2 is, with the increase of sexual promiscuity, just the world is different now, right? Like, obviously we don't know what it was like in the 50s, but we've certainly been told. And so, the same HPV that's being found in the cervix is now being found in the mouth. And, that's really where it's coming from. And, we could certainly say, yeah, in the 50s, what was accepted and what was happening is certainly different than now, right? I mean, just from what we see on TV is different. So, our world is different, and with that comes consequences, right?
No, I guess that makes a lot of sense. It's, by the way, I never want to think about my parents in the 50s, 60s, 70s. Like, you know what? Parents, keep that to yourselves. Like, you guys met, you're high school sweethearts, and that's all we need to know. Okay. That's good enough.
Right.
So I kind of have another kind of tangential question to this, because I feel like anymore in our offices, we're being told like we need to be screening more and more and more, right? Like we have tools, we have, devices, we have things that we can use. But one of the problems I feel like there's a big pushback is that the hygienist doesn't feel like it's their responsibility. I just read a thing yesterday about this as well. It's like, you don't feel like this is your role or your scope of practice. Like, what could you tell us about kind of that attitude, I guess?
Yeah, I hear that. And I totally understand, especially, in this post-COVID world that we're practicing in. We have tons more things piled on us, right? You've still got that same hour, but there's so much more from an infection control perspective. Obviously, with that has come the challenges of, loss of people from the workforce. And then, so supply and demand, right? So now it's costing more for, doctors to employ hygienists. And so there's more, I think, that's being put on us from, you have to produce, we have to get this money back out, right? Like, we're losing. So I totally empathize with that. But I think, when we come back to thinking about, why did we go into this profession, and what are we truly here to do today? What is our job? And the one thing that, I say all the time is, as terrible as periodontal disease is, and as much as, we want to cure that, we want to fix that, we want patients to be better, it's not life or death. And oral cancer is, and we have the ability to truly change a patient's life just by offering a screening. So, I think it's coming back to taking a step back and looking at the bigger picture. And like, if I've got to cut something out of this appointment today, what's the most important thing for my patient? And not that I want people to cut anything out of the appointment. I want to do all the things, right? But that, I think, is something that we all, as clinicians, hygienists, dentists, all of us really have to own, right? Is that this is our duty and our obligation to our patients to do this and tell them, you're healthy or you're not healthy. There's something going on. Let's figure out what it is. So I think taking that mindset and changing the way that we're looking at it, there's no excuse. It absolutely is our obligation to do this screening.
Because I feel like we've had more lectures about HPV, we've had more lectures about oral cancer in probably the last decade than probably years and years before. And so I feel like we're probably diagnosing more the prevalence is higher, but we're also diagnosing more. Are we doing a good job in dentistry compared to maybe like other cancers or other professions?
Yeah, great question. Unfortunately, no. So we are seeing a 5-year survival rate increase for most major cancers over the last 3 decades. So 5-year survival rate is how they metric success in the cancer world. So 5-year survival rate means if I'm diagnosed with cancer today and I live 5 years and a day, by definition, I'm considered a success in the books.
Weird, so by the way.
I'm sorry.
That's weird.
I know. Isn't it? I mean, it is kind of sad of like, 5 years is all we want. And then, that was successful. I know it is a little bit of a Debbie Downer, right?
Yeah.
But
Yeah.
I think, what's interesting is like, take, for example, breast cancer. Breast cancer's 5-year survival rate in the like mid 1970s was around 75%. Since the early 2000s, the 5-year survival rate of breast cancer is now up around 90%. And when I think about all the things that breast cancer does, right? You've got commercials about it. So they're doing a fantastic job of public awareness, public education. Every female is conditioned that at, 40 years old or sooner, if you've got a family history of it, you're going to get a mammogram. So you're going to do screening. We're doing, early detection of breast cancer. So, in comparison to something like that, as an industry, we're falling far behind. And, I think the other thing that is worth mentioning, I feel like, there's these 3 pillars, right? There's public education, there's early detection, and then the other thing is technology, what they were using to do those mammograms in the mid 70s is probably not the same thing that they're using now, right? And for good reason, because we perfect things, we make things better. We realize, we can do better. And so that's, where as an industry in dentistry, we're not matching up. And some of that is our own, I think, needing to take accountability for that, really, truly accepting that and diving into, okay, so how can we change that?
All right. So I think one of the things I think the listeners are probably wanting to know now is like, okay, like what's the right thing to do? Okay. So we know that we're supposed to be doing like intraoral, extraoral, but do you mind walking us through like kind of what's your advice for like completing that whole entire assessment?
Sure. Yeah. So certainly, it is the standard of care for us to do a visual and tactile exam. I think one of the biggest things that is missed is the extraoral exam. And, we talked about HPV, and truly HPV is changing not only the trends, but it's also changing the way that we need to be screening for oral cancer. So 70 to 80% of HPV positive oral cancers occur in the oropharynx or the back of the throat where we can't see. So regardless of, if I'm using any technology or I'm not using any technology, you can't see where you can't see, right? When we start going where it's not visible in the oral cavity, what can we do? And that's where that extraoral exam is so important, because sometimes the first sign that something is going on that far back is going to be a swollen lymph node. So making sure that we are, first doing a thorough extraoral exam, starting from the time, that patient's walking with us into our chair, they're sitting in the chair, we're looking at them, I'm taking their blood pressure, I'm looking for symmetry, all of those things that we're trained to do. But again, we start cutting those corners because of our time constraints. This is a piece that we really can't skip. And I think sometimes too, that maybe we hesitate to educate the patient on, I'm feeling around, it feels like I'm giving you a massage, and this is why I'm doing it, right? Because maybe we feel like that's awkward or weird, or especially if, they've been coming to our office for 15 years and I've never done that before. And now I'm like, oh man, I really need to tighten up on what I'm doing here, right? I need to revisit, and this is different. But having that conversation with the patient while we're doing it, I'm doing a head and neck exam, and the, trends of oral cancer have really continued to rise. And so here's what I'm checking for. I'm feeling for any abnormalities, any lymph nodes, and really using that as an opportunity while I'm doing it to educate them on what I'm doing is important. And, giving them obviously an opportunity to ask questions, but palpating, the lymph nodes in the neck, under the mandible, behind the ears is so, so important, because again, that's where HPV is truly changing not only the trends of oral cancer, but the way that we need to be screening for it.
I think one of the things about that too is like, for me, when I was, consistently doing it, I would walk them through and I would say, this is what I'm feeling for. If at home you are feeling this is something I need you to come back for and let me take a look, or let doctor take a look. And then, so you're kind of teaching them and training them also, which is really good. But also, how many of our patients are checked out of that appointment, right? They're just like,
Yes.
I'm not even listening to anything you're saying, but this massage feels great, right? But if you can kind of get them back focused, be like, hey, cancer,
Yeah.
wait, what? Like now they're paying attention to it. And if you are an educated individual, and this is just me riffing on like my opinion of life, if you're an educated individual and you're explaining what you're doing, think now, like this is the first part of the appointment usually.
Yeah.
Think now for the rest of that appointment, how you're setting the stage of, I'm a healthcare professional. You should be listening to me. I know all this stuff about, oral cancer. I probably also know stuff about teeth and gums, right?
Absolutely. I couldn't agree more. And it goes back to, when we were just talking about like breast cancer, and not that, you would necessarily know this, but, all of us as females know they do a really good job of educating us. Here's how you need to be doing your exam at home. And so same thing, just like you're saying, I love that of saying, hey, if you notice this at home, you need to tell me. And what a great opportunity to open up the conversation for them to say, hey, you know what? I've actually noticed this. Do you feel this back here? Of like, maybe they've felt a lymph node, and then that gives them an opportunity to point it out to us because, a lot of times they know better than we do, that they've felt something in their neck and can bring it to our attention so that then we can address it. So, I think there's a lot of different reasons to, be having that conversation with them instead of, how's your mom? How's your dad? The thing that we're doing where we're just trying to make it like this fluffy experience, but it truly is an educational opportunity.
Yeah. And we have a few minutes left. And I was hoping maybe I could get you to talk a little bit about, I guess, big picture. I know you don't know like all of the devices and how all of them work,
Sure.
but just like, like fluorescence, lights, what are we looking for? Why should we be using technology in addition to our kind of like manual palpation things?
Yeah. Great question. Technology, I feel like in enhanced oral cancer screening specifically has gotten a bad rap. As with any technology, there is a first generation and then there's, what we have now. So it has come a long way. I think the biggest miss when it comes to technology as it relates to oral cancer screenings is that we're not accepting that this is a screening tool. It's not diagnostic. It's not meant to diagnose cancer. It is very similar to our loops. It's helping us to see things, but just like our loops don't tell us like, oh, this is a cavity here. It just helps us to see better, where then we have to use our clinical knowledge. So that's really what these devices are intended to do. And I think some of it is, as an industry, us needing to change our mindset, right? And really thinking we have these tools that are available to allow us to see tissue abnormalities earlier. So I like to think of them as like tissue highlighters. It really can just help point out areas that we may not have seen with the naked eye. What better opportunity do we have than to find, something in its earliest possible stages rather than when it's stage 3, when it's stage 4. And that's, really the biggest problem with oral cancer is that we don't find it until it's this huge mass and then it's really bad and we don't have a good prognosis for the patient. So, like I have another example just in, when we're talking about our other like healthcare counterparts and what they're doing this year, we said that the American Cancer Society is estimating that there will be 54,540 cases of oral cancer. They're estimating that this year for cervical cancer, there will be 13,960 cases. So there's going to be an estimated 4 times more cases of oral cancer than cervical cancer. And I think it's important, when we talk about technology and we talk about, how things evolve, right, is when we look just specifically at that example, when we're talking about oral cancer versus cervical cancer. In the 1950s, there was a pap smear that was created. And what did the pap smear do? The pap smear made every OBGYN become proactive, and they did a pap smear every single year on every female over the age of 40. That changed the trends in the 1950s from an incidence of 35,000 in cervical cancer, dropped it down to 11,000. And it wasn't the test that changed the trends. The test was only 50% accurate, but it was the fact that these doctors were being proactive. And that's what we need to be doing with oral cancer. So taking advantage of the fact that these technologies allow us to be more proactive, to find, tissue abnormalities when it's just a small cellular change rather than when, it's metastasized, so that we can give these patients a better prognosis. So I truly think, beyond that, yes, we should be leaning into and taking advantage of the technologies that we have. It's truly changing our mindsets into being more proactive instead of reactive.
All right, last question. How do you feel about April being like this blown out month for Oral Cancer Awareness Month, and then we all kind of forget the rest of the months? How do you feel about that personally?
Honestly, I'm thankful that we have a month that highlights it, right?
Mm-hmm.
So at least, we have that. But it truly is amazing, being on my side of the industry, how many people lean into that. Like sales in April, 100% are way more than they are in any other month. I've even tested the theory and run a promotion in the month of April and run the same promotion 2 months later when it wasn't Oral Cancer Awareness Month, did not come anywhere close. So it really is sad that, it's like, oh, okay, I'm going to check that box this month, but then I'm not going to care about it as much the rest of the year. And so I really do think, again, I go back to, this is truly a life or death, opportunity of a service that we have to offer our patients, and something that we all have to take ourselves as clinicians, ownership and accountability of our role and what can each one of us do to change that. So I think the most important thing for each one of us as clinicians to really think about is, if your next patient in your chair was your loved one, do you feel confident in the screening that you're providing and in the technology that you're using to tell them you're healthy, you get a clean checkup, and to send them on their way? And I think, that's what we all need to be asking ourselves every day on every patient. Did we do a good service? Did we really do our job?
No, you hit it right. It's early detection. And I think, one of the things I was always trying to tell my hygienist, that you're going to have thousands of no's. Like there's going to be people are going to say, no, I don't want the test. And, or you're not going to find any abnormalities. But that one that you do is completely going to change your outlook on all of this for the rest of your life. You will never stop doing it once you find that one. But unfortunately, if you're not looking, you'll never find it. So, Ellen, thank you so much for being on. If someone wants to reach out to you, if they want to contact you, how can they do that?
Yeah, you can find me at, my email is emeyers@forwardscience.com. You can check out, our technology, learn more about oral cancer at forwardscience.com, where we have, our option is the oral ID. But I would love to answer any questions anyone has. And, I appreciate you taking the time to highlight this, as it's so, so important for us to be talking about. And I just appreciate the opportunity to spend some time with you.
Oh, happy to do it. Well, thanks for being here.
Thanks, Andrew.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.